Hey, what up y'all, it's me your boy Lil D coming at you from the den with another nursing video. And in this video I want to talk about two qualities that you need in order to be a good nurse, and without these they could really affect your potential in the healthcare that you provide. But before we get into that, make sure you give this video a like and subscribe. I post nursing related videos 2 times a week here on this channel on Wednesdays and Sundays, so if you haven't done that, you could go ahead and do that now. And one more thing, leave a comment down below telling me what do you think makes a good nurse. But yeah, let's get straight into it. I just got done working the past couple days at the hospital, and I actually had some really nice patients. Now I know patients are going through a lot when they're in the hospital and stress levels are elevated, and it's oftentimes that we get these patients that just lash out on the nurses, on the healthcare staff, just because they're so overwhelmed with everything going on. And where I had these patients, they were really kind to me. I had gotten in a report that they had lashed out on some employees. I do believe that these patients are good people and they're just going through a really tough time. And this is kind of how I got on the topic of what actually makes a good nurse. Now in nursing school, I'm not gonna lie, for my associates, I did go to a community college, and going to that community college, I did not even get good grades. I got C's throughout the whole program. I struggled the entire time, and I would say starting off as a nurse on my unit, it did take me a little while to catch on, and I did feel very overwhelmed, but I had these two main qualities that I feel every nurse should have. And regardless of what kind of grades you got in school, what kind of GPA that you have on your resume, that if you don't have these, you won't be a good nurse. Now the first quality of two that I'm going to be talking about is having patience with your patients. Taking your time when you go in the room to actually listen to your patients. Now I know working in healthcare, we stay busy. I have 4 patients on a shift and I have a lot of things to do, a lot of things to address, but it makes all the difference when I go in the room in the morning at shift change and I introduce myself and I ask them if they need anything. Compared to when I get shift report outside of the room and I go and introduce myself and walk away. This first interaction can determine how your day is going to go completely, and it's just taking a little bit of time to address what the patient needs or what they want to ask the physicians today that can make all of the difference. Now you're probably a little confused because you didn't think that I'd be going down this route of what makes a good nurse. Yeah, having good IV skills is nice. Yeah, being able to multitask and get things done is also nice, but at the end of the day, we're here to take care of the patient, and the one thing that they need, the one thing that they look back on when they go to the hospital is the kind of care that they received. And the ability to listen is actually the second quality that I truly believe makes the difference between a good nurse and a great nurse. And this goes along with my first one of having patience with your patients, is actually taking the time to listen to what your patient has to say, to listen to the concerns, and this can really decrease their blood pressure, this can decrease their anxiety, and this can decrease the amount of work that they put on you that day. And this is where I really feel like a nurse, is when I'm taking my time to make the patients feel better. I don't always feel like a nurse when I'm pushing these medications or giving them a cup full of pills. I feel like a nurse when I can actually take a moment and listen to what they have to say, and at the end of that conversation, they tell me thank you. But it's really about the way you approach the situation. When you walk in the room and you're like, hey, and you get on the computer real fast, they can see that. But when you walk in the room and you say, hi, I'm David, I'm going to be your nurse today, and then you slowly make your way to the computer instead of just jumping on it, they can see that you're a good person and that you're there to help them. And this could really decrease your workload, like I said. And it is these two things that I truly believe make the difference between a good nurse and a great nurse. And without these skills, are you truly even nursing? But that is about it for this video. Make sure you leave a comment down below telling me what do you think makes a great nurse. Make sure you check out one of my other nursing related videos. And yeah, I'll talk to you guys later. Thanks. Bye.